It's the cold hard truth. Everyone really want to know what's going on with her show. Just get on the air and you will know it's Sandra. The queen of the mile road is here, helping people from everywhere. Get on the phone and you will hear Sandra. Now she will tell you how it goes, but don't you ever step on her toes, 'cause you will hear the cold hard truth from Sandra. They say she's the hero in town, helping people from all around. You get a call, your money is found, it's Sandra. Some will call her late at night just to say that there is a fight, and she will not just leave it alone. She'll get up and call on the phone, and when politics starts on her show, everyone really wants to know the way the things will really go with Sandra. Some will start to criticize, get on the show and tell pure lies, but someday we'll realize it's Sandra. And when they start to argue again, she'll pull the heads to the wind, and soon you will be a friend of Sandra. 'Cause every day everyone wanna hear from Sandra. Every day, everyone wanna hear from Sandra. 'Cause every day, everyone got to hear from Sandra. 'Cause every day, everyone got to hear from Sandra.
Good morning, my beautiful people. It is Tuesday. Yes, May the 26th, the last day of May. Then we're headed straight into the summer months. And let me tell you, my apologies, I got a little frog in my throat. Oh, it's going to be a warm summer. I can feel it already. Well, it is Tuesday, which means that it is Medical Rundown Tuesday. We have our special guests in the studio who join us weekly, Health City, Cayman Islands, and they always bring interesting and informative topics to the table. So let us go ahead and welcome Mr. Shamari Scott. I believe he's supposed to have some good news for us today. Is it today or next week?
Yeah, it was supposed to be today. I have good news and I have bad news.
Uh-oh.
Well, good morning, Sandy. Good morning.
Good morning.
But definitely the good news is, we're in the over 40 league. So the great news is we didn't lose last week. So
okay,
that's amazing. Unfortunate news is, we didn't get to play. So
okay.
So we're still in the semifinals. We're still undefeated in the semifinals, but we haven't gotten a chance to play. There was some. Well, you would have seen there was some sporadic rain that would have happened.
Yes.
As we play on an outdoor court, there is a game that needs to be made up based on it being rained out. So we aren't even playing tomorrow. So our semifinals has been delayed until next week, Wednesday.
Okay.
Fingers crossed that tomorrow they get to play that final game, and then we'll know who we're playing in the semifinals, and I can give you some good news moving forward. We've been making jokes in the chat group saying by the time we play again, it will be at over 50 league. But
my goodness,
they're giving us rest, so we can't complain.
Yeah, I feel you. All right. Well, good luck when you get to it. We enjoy you keeping us up on your physical activity, which is so very very important. I must say that the weather does look a little bit ominous, so I'm not so
Um,
sure about this week.
fingers crossed, and hoping,
Yeah.
tomorrow the rain holds up and we can actually, you know, the other teams can play, so we have somebody to play against. Sandy,
Mm-hmm.
question for you.
Yes.
So, World Cup is coming up, right?
Mm-hmm.
hmm does your husband have a team?
I don't think so.
Oh, I was wondering, 'cause
Yeah,
I was
he's
gonna guess
not.
I was gonna
Yeah.
guess his team would be Brazil, right? But I was
Yeah.
wondering if he actually has a team or not. But
I
okay,
mean, Marlon's a little bit funny. If it's a big event like the Super Bowl, he'll watch it, but I think he watches it just for the commercials. So I'm not so sure about World Cup. He's never really demonstrated that he gets into it that much. If Jamaica was playing now, obviously that would be a different situation. Um, but yeah, I've never heard him get all that excited about it.
okay. Well, it's coming up
So
shortly, so
yes,
my team is Brazil, so you'll be
Brazil.
hearing about
Okay.
Brazil shortly.
Okay.
When the World Cup starts, when the World Cup.
Yes. Well, we'll have to talk about it. I keep encouraging people. We need a sports show. Of course, we have the Cayman Islands Football Association. They host their own show, which is great and interesting. But it would be so good if we had a show just sports, generally speaking,
Mhm.
because there's so much that's happening in the world of sports, and of course, this time of the year and every 4 years is World Cup time.
That's
So it
right.
gets even more interesting. So if you sitting here listening to the program and you enjoy all things sports, reach out to us because the CMR Creatives team is always looking for additional talent. Any kind of show really that you want, we could have a discussion. Remember that CMR radio applications in soon come. So
And,
you're
and
going to be on radio and social media as well.
and sports is ongoing throughout the year, so there will
Yes,
always be
absolutely.
topics, and you might have to change sports every now and then in regards to what you're discussing. But yeah, definitely think that would be an amazing segment. And because I have a lot of friends that are from Ghana, not Guyana,
Mm-hmm.
Ghana. Ghana is my second team, so the last time when I went to the World Cup, it was in Brazil. We went to watch the three games that Ghana played with my college friends.
Mm-hmm.
So that was very interesting, actually being able to
Mm-hmm.
experience the World Cup in Brazil. And now, obviously, it's in the US, Canada, and Mexico. So hopefully, seeing as it's so close, a lot of people will get the option to go watch a game or two. But
Yeah, it's so strange because someone was saying to me yesterday that, as close as it is, they would have loved to attend it, but there's so many other things happening in the world of politics that has kind of discouraged them from going. So that's unfortunate. But anyway, I'm sure a lot of people will be looking forward to at least watching the games, the matches on TV.
definitely.
So we have got
Yes.
Dr. Cyril in the house. Give us a
So
big virtual applause for Dr. Cyril. Good morning.
drum roll,
Morning,
drum
Sandy.
roll. But we definitely thank Dr. Cyril for coming on today. And
Yes.
today the topic is
It's
going to be something that people don't realize they may have, and it comes to
Mm,
food allergies, especially as we age. Trust me, now all of a sudden, we had a conversation. It was just on Sunday with some of my friends in regard to what they could eat and drink in their youth, and then all of a sudden they started to have issues, and they're finding out that they're
mhm,
allergic to milk, and they're allergic to gluten, and they already have an intolerance, etc. And it was a great conversation. But so my mother doesn't get upset with me, as always, I'm going to introduce Dr. Cyril,
mhm,
who is our consultant gastroenterologist. And Dr. Cyril Alex is an experienced gastroenterologist and integral part and member of our gastroenterology team and unit at
mhm,
Health City. He's been with us since 2022. So he came to us right on the heels after COVID and hasn't looked back since. He performs over 1,000 procedures annually with a great safety record.
mhm,
His areas of specialization include ERCP, cholangioscopy, EUS and EUS guided drainage, as well as advanced endoscopic procedures such as ESD. Um, Dr. Alex is also certified in minimally invasive techniques, including endoscopic sleeve gastroplasty, ESG, and transoral incisionless fundoplication. Is that right? Fundoplication? TIF. Did I
I'm just glad I'm not having to
pronounce
pronounce these.
that right? So it is transoral incisionless fundoplication, TIF, and we offer patients innovative and effective treatment options in all the various gastrointestinal care. And we thank Dr. Cyril for coming on the program, and we look forward to having an amazing program with him as well.
Thank you.
Wow, those are some big words, Dr. Cyril. All I know is you're an expert.
Small man.
Dr. Cyril wanted to test me this morning. That's
Yes. They gave you all the hard stuff. I'm just glad it was you and not me. But Dr. Cyril, obviously your record and expertise and experience speaks for itself. So welcome so much to the program. Again, it's a pleasure to have you here. Now we're talking about a topic that, quite frankly, I never thought that I would personally have to encounter, but lo and behold, I do, because I think my daughter has some sort of a food allergy. We're trying to, narrow it down, but anytime she eats at Chick-fil-A, probably because that's just not the best option. But hey, when you go to the States, you crave a little something here and there. But anytime she loves Chick-fil-A, but when she eats there, she gets a rash around her mouth. So we haven't quite figured it out. We don't know if it's like the oils that they're using or something else. But for now, she can't really have any Chick-fil-A. So I feel bad because sometimes I will treat myself to Chick-fil-A sandwich and those also bad fries. And she just sits there looking at me with a side eye. So let's talk about food allergies today. This is actually quite a serious conversation because there are people who have a very severe response and might need medical intervention. So, wow, food allergies. Help us understand what this is even.
All right. Let's start with a general term like food-related issues, food-related hypersensitivities, of which, we can broadly divide it into two. One would be something that is like a immune mediated, like a typical allergy. Okay. And the other one would be a non-immune mediated. So I'll give you an example for us to just understand these two criterias. One is the typical peanut allergy that we all know about, the skin flares up, reds, you become swollen up, breathless, multiple systems affected, your pressure goes down. That is the immune mediated, like the anaphylaxis. That is one immune mediated. Now, food can have non-immune mediated, means the immunity is not that active. Imagine the example would be the lactose intolerance, which we hear a lot about. So basically, what is happening in that? Your body, your small intestine, is deficient in an enzyme called as a lactase, which breaks down the milk sugar, the lactose, into absorbable form. So if you are deficient in it, the moment you have significant amount of lactose, your body can't break it down. You feel bloated. You feel having that's not a milk allergy per se. Milk allergy, you can have a different type of a milk allergy, especially in pediatric age group kids. You can have allergy to cow's milk protein. So this is a broad division wherein you can have an immune mediated allergic response or a non-immune mediated due to deficiencies of enzymes, but the manifestation may look more or less same. And in between these two spectrums, even in that immune mediated, you can have lot of delayed response, delayed allergic response, not the typical that acute thing that you see. You relate to a peanut allergy. You can have a delayed, slow response which can manifest over weeks, months. The celiac as you know, everyone must have heard about celiac. It's the other rare things, which are coming up, something called as eosinophilic gastroenteritis. These are all food related allergies, which comes in, not the typical flared up anaphylaxis that we usually associate to. So it's a broad spectrum, and even in that immune mediated, which we talked about, the food allergy, it can be mediated through various pathways, like the typical IgE, let, so it is a broad group, and there are various ways with which we can test, the different types. The easiest one to identify and test would be the immediate anaphylaxis. You take it within minutes, you just flare up, you become red. And coming, it was interesting when you talked about your daughter. One of the commonest prevalent allergy is something called as a pollen or oral allergy. So basically, oral food allergy is basically, it is usually triggered with the fresh vegetables, the sap, the fresh fruit, the pineapple, and usually affects the oral cavity. And the moment it goes down into the stomach, the acid degrades it, and you may not see the typical allergy, but it usually manifests in that oral area. But it usually seen with the fresh vegetables, fresh fruits. The same fruit, the same vegetable, if you cook it, they may not have anything, because cooking, degrades that active component.
Oh,
These are
wow.
all some clues. With This would be the broad categorization of food related hypersensitivities. So all food related issues are not allergies. Yeah. Yeah.
I see. Wow. Okay. So interesting. We're going to definitely be learning a lot here today because already I'm like, okay. And let me just ask you a general question. It's possible that someone may not have been allergic to something, and then all of a sudden they are. Does that ever happen?
Yes, absolutely. That can come up. Especially you can have, as you age, you can have trouble with shellfish, shrimp. You were never allergic to shellfish, shrimp in the past. Then, as or when you hit 50, 60, suddenly one fine day, you start becoming allergic. Lactose intolerance. This can come up later in life. That is another thing. As the age goes by, you never had an issue with milk products. Then suddenly you start having issues bloating the moment you have milk. The possible. Then there are certain confusing aspects, in the sense there could be cross contamination, additives. These are some of the most confounding things. It may not be the meat or the shrimp; it's the food additives, the monosodium glutamate. You never know. So usually we can have patients who come and say, when I cook at home, I never have an issue, but when I go out and have this, yeah, I just feel bad, awful. It could be completely unrelated. It could be the additives, the food coloring agents, the monosodium glutamate that you use. Rarely, you can have what we call as cross reactivity. For example, someone who has allergy to maybe cat fur can suddenly have a intolerance to pork, meat. So it's completely unrelated, but that's because of the cross reactivity. Then yeah, these are some things. Yes, you can have things come up later in life, and you can have the other way around also. While you in children can have issues with cow's milk, eggs, but most of them, a large percentage can outgrow it. So as they age, when they become adult, they don't have that initial problem. So these are some things which can go either ways.
Interesting. Okay. All right, folks. So clearly something you just need to keep an eye on. Let's talk about some of the more common triggers. You mentioned dairy already. Gluten. We hear a lot about gluten. Can you tell us exactly what gluten is?
Okay, so basically, the gluten is a protein, which
Mm-hmm.
is more commonly found, wheat, rye, barley, and wheat, it's a component, it's a protein component of these things. And
Mm-hmm.
again, it can these proteins, the gliadin, gluten, these are some proteins in the wheat. You can have issues with the digestion of these proteins.
Mm-hmm.
So if you have a genetic predisposition, you have that genetic defect for celiac, and you have gluten, then you
Mm-hmm.
develop celiac disease. But if you
Mm.
don't have the genetic predisposition, but your body is sensitive to this gluten in the wheat, barley, rye, you can have bloating, diarrhea. Even without having celiac, you can have these symptoms. Now,
Right.
so basically, these are certain components of wheat which trigger allergies, trigger an immune mediated response in our body.
Mm-hmm. And but I understand that the everything now is marketed as gluten free. But my understanding is the average person isn't really having an issue with gluten. I don't know how it started to get so popular, but the percentage of people who actually have a gluten allergy or even intolerance is actually quite low. Is that right?
Yes, like I said, but again, I told you, you can have components of wheat, either there are, so that's why we have things called as celiac disease,
Mm-hmm.
non-celiac gluten hypersensitivity, wherein, that spectrum of patients will have trouble with all sort of gluten. And you
Mm-hmm.
can have non wheat hypersensitivity, wherein other glutens from other it's not exactly for the gluten, it is to another component in the wheat, so they'll only have problem with wheat. So wheat hypersensitivity, so when we try to mix everything together, everyone goes on a gluten-free diet. you know, yeah,
Mm-hmm.
because the symptoms more or less will be same. You get bloating, you get gassy, you get fatigue, brain fog, you feel tired, loose stools. So to differentiate between these three, because these are not like immediate hypersensitivities, so it is very difficult to prove it based on a blood test. These are what confuses the picture.
Mm-hmm. All right. So symptoms may occur immediately or develop gradually over time, depending on the condition involved. And so, do you recommend that people do sort of any sort of testing to see if they have a food allergy at some point, or do you just wait until an issue manifests itself?
I would not, because the dictum, the dogma that that's generally proven. Even if you do a blood test, I told you the blood test, the allergy, the it just captures one subset of food related hypersensitivity.
Mm-hmm.
So you can have an issue with wheat, but the blood testing may not show it. It's not that you are wrong. It is just that we are that testing is just covering one part of the food related issues. We are not testing for that. And the main dogma that we prove, if you are asymptomatic, if you don't have symptoms,
Mm-hmm.
if that test, you shouldn't go after that test.
Mm-hmm.
You should not, even if the test shows that you are allergic to that, but you are absolutely fine with a particular food component,
Mm-hmm.
you may not. The only difference being celiac, where that is those conditions are different. But
Mm-hmm.
you don't need to have a general food allergy testing unless you're symptomatic or you have an issue. You don't need to have any testing done for the
Right.
public. Yeah.
Okay. All right. Folks, don't forget if you have any questions, the phone lines are open. 936-2626 is the telephone number. And let's talk now about some of the symptoms because I don't know. Sometimes you feel like you just have an upset stomach. Is it a food allergy? Is it an upset stomach? So we're going to talk about how you try to figure out which one it is. I mean, I have IBS, so I feel like sometimes certain foods can make that worse or bring on an episode. And then other times it's just like stress or other things kind of impact that gastro issue as well. So, right, common symptoms: abdominal pain or cramping, nausea and vomiting, diarrhea or bloating, skin reactions such as itching or hives, fatigue. This one's interesting, or unexplained digestive discomfort. And then in more severe allergic reactions, you have what we know, like the swelling, the breathing difficulties, anaphylaxis. And that's where those people will carry things like EpiPens, and, they're normally quite aware of how severe their allergies can be. One of the big ones is a nut allergy. What is it about nuts that make human beings more prone to be allergic to nuts?
So again, it's it has a geographical difference. Some countries don't have that much of a prevalent nut allergy. Uh,
Mm,
so definitely there is a genetic background. Um, uh, but some areas definitely doesn't have this much of a nut allergy issues, but
mm-hmm,
definitely a genetic background there. Then we all go back to the hypothesis of uh, introduction of early allergens, because you're a child, an infant, or immunity is just developing. So when you start early oral feed, that exclusive
mm-hmm,
breastfeeding, 6 months, these are all hypotheses. When you introduce certain foods early on,
mm-hmm,
the immunity, the immune system which is developing in a child may start taking it as an allergen.
mm-hmm,
So is that the reason why more food allergies are coming up? We can't explain it just purely based on genetics alone, but definitely there is a genetic background, and it is more severe in these IG that anaphylaxis. Those tend to remain more or less the same throughout the life. But the other minor ones, like how I discussed, the cow's milk allergy or the egg, these over years can improve, disappear. So definitely, there is a lot of interplay between the genetics, the bacteria flora, the developing immunity of the gut. uh, yeah. So
mm-hmm,
very hard to pinpoint one say, but yes, it is highlighted because of the severity and how common it can come into the food accidentally. And since it is like an anaphylaxis, the reactions are severe, life threatening.
mm-hmm. Right. And now I've read for quite a number of years that there is some degree of research to show that if you introduce, even if there is that genetic component, right? So one of the parents has a severe food allergy. If you start to introduce the nuts earlier in small quantities, you almost develop I don't know if you'd call that an immunity, but your body isn't going to have that severe allergic reaction. So, is there now a methodology that physicians recommend for children where you start to introduce like a little bit of peanut butter when they're a bit younger?
You're right on that. That's basically what the approach called as a immunotherapy. So actually, for peanuts, there is a formulation that has been brought out, wherein it is a protein powder, peanut protein powder. I can't recollect offhand the preparation name. Sadly, the production is being taken off. I think from next month onwards, I think it's being stopped. So what that does is, definitely under medical supervision, because these allergies I told you, these are IG mediated, immediate, like anaphylaxis, which can. So usually they go on a small sensitization dose. They start with a small dose, see how they respond, and
Mm-hmm.
as the weeks goes by, they slowly introduce more of these, so that the body starts getting adapting to this dose, and those accidental exposures or minute dose inducing a severe reaction can be taken off. they may still get it when they consume, a big amount, but those accidental school exposures, when they are out, cross contamination, those
Right.
severe anaphylaxis can be taken care of to an extent, because they start getting tolerance to some amount of nut.
Ah.
That is basically what we call as the immunotherapy. So again, some of these allergies, you
Mm-hmm.
go to an allergy specialist under their care, under their guidance, you introduce these things slowly. Yeah.
Mm-hmm. Wonderful. All right. So we've got Johan in the comment section making trouble as usual. Just FYI, Shamari, he's actually not blocked from the comment section. So that's why you see him there. It's not that he's out of jail. He just can't call in anymore. Miss Abby says, I'm no doctor, but it seems like this patient is suffering from brownie withdrawal, referring to you. Adriana says, Dr. Cyril is my doctor, very good doctor. I did the ESG procedure and a lot of my issues have gone. He is a blessing. What is this ESG procedure? What is that?
So it is basically a weight loss procedure.
Oh,
Okay.
okay.
So it is not a surgery. It
Yes.
comes in between the surgery and the medication.
Oh,
So,
okay.
you don't get those dramatic weight loss as surgery, but you get that intermediate, wherein you want to lose some weight, but you don't want
Mm-hmm.
to go that surgical route. So we try to do it endoscopically,
Mm-hmm.
wherein you don't have any scars or anything, but never,
Mm-hmm.
and the recovery is just overnight stay. That it is a balanced between surgery and
Mm-hmm.
medication and diet, somewhere a middle path.
Oh,
Okay.
interesting. Okay. Right. So let's talk then about this celiac disease, something I've heard of, but I don't really know much about it. So what is it?
So again, coming back to that gluten, these are components, and most commonly, like I mentioned, the wheat, rye, barley. The
Mm-hmm.
glutens in these, when you have a genetic predisposition, you have a genetic defect, when
Mm-hmm.
this component comes through the food, it starts inducing an immune response and start attacking your small intestine predominantly. So what happens to the small intestine basically looks
Mm-hmm.
like our coral reefs, like finger Villay.
Mm-hmm.
That's where the maximum absorption, everything is absorbed in your body, all the absorption. So these, in celiac disease, your small bowel starts becoming atrophied. It gets damaged. Then you start having diarrhea, iron deficiency, uh,
Mm-hmm.
because your main absorption site is being damaged,
Mm-hmm.
and you start developing. And the best treatment is first identifying and diagnosing it, and
Mm-hmm.
strict gluten free. This is the only one subset wherein you say strict gluten free.
Mm-hmm.
All the others, no. Yeah. But so this is strict gluten free,
Mm-hmm.
because even if there is an accidental cross contamination, sometimes oils, accidental ingestion, the cycle goes through. So the treatment is an absolute avoidance of gluten. No other
Mm-hmm.
medication is needed. We just need to track that no gluten is getting involved. And with this measure alone, your
Mm-hmm.
small bowel comes back to absolute normal, heals, and completely becomes normal. And you lead a
Interesting.
normal life. Yeah.
Right. Wow. Okay, we've got a caller in the line. Good morning, caller. Welcome to the program.
Good morning, Sandy. Good morning, Shamari. Yes,
Good morning, darling. How are you? Welcome back.
I've been back but a long time, and I called, but I called
Mm-hmm.
to say a very special good morning to Dr. Cyril. I saw him yesterday.
Oh, nice.
Very present, nice, good doctor. And I'm supposed to see him sometime early in the week, not with me, but with my husband. Good morning, Dr. Cyril. How are you this morning?
I'm good. I'm good. How are you?
You remember Mr. Billy yesterday?
Miss Power? No.
Mr. Billy. Miss Shalman, Mr. Billy.
Yes, 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 yes.
You
I saw
forgot?
you yesterday. I saw you yesterday. Yes, yes, I remember
Yeah,
That's
very
he
why I
had, he
tell
had
you.
to think about it.
That's
yes.
why I called to say a very good morning to you because you're a very nice, pleasant doctor. Very good. And I have no problem with the Health City team. We're like family. Only the newer people don't know us, but the older people, anytime we come, they welcome us with open arms. Your family, all the nurses, all the doctors that I've met, very good. Very, I don't have a with Health City. I give it 2,000%. I guess if it wasn't for Health City, my husband would not be still living. So I got I got good results. I don't care what nobody say. Like I say, some people, doctors can only do so much because some people wait till they're almost ready to kick the bucket. You would say, and then, well, doctors are not God. It's only God. I mean, doctors got knowledge, but they can only do so much and no more. So for what I experienced, and I've been running at them already nearly, if I'm not going to 4 years now, and
Yes.
I've had no, but if I see something that I don't like, I speak, but I must say, they give my husband good care. Everyone that, everyone that I've seen, everybody, and he been through quite a few doctors, so I have no problem. I rate them 200%, not 100. And like I saw Dr. Cyril yesterday, and I think I'm gonna hopefully I will see him sometime later on in the week. So I just wanted to give him a very good morning, and I thank you, Dr. Cyril, for everything you've done and what you're gonna be able to do or whatever. So that's all I have to say.
Thank you so much.
No problem.
I appreciate it. Thank you, my dear.
Yes, ma'am.
All right. Have a good day.
You too. Okay.
All right. Thanks so much for that call. We hadn't heard from her in a little while. Right. So celiac disease, basically, you've said you can get this under control by purely adjusting your diet and removing gluten exposure completely. Okay. And what are some of the symptoms then of celiac disease? Like, so how does someone know if they even have this?
Yeah.
Is there a test that they take?
Yes, so we call it as a classical celiac, wherein you have the typical symptoms. You have gluten, you have the diarrhea, you have the bloating, everything. Then there is the non-classical. In medicine, it's never straight. 1 + 1 is never 2. So people can have reflux, acid reflux, fatigue, the chronic fatigue, the brain fog. In young children, sometimes seizures. So pediatric age group, unexplained seizures, they do check for this celiac. So growth stunting, the child is not growing. Then anemia, iron deficiency, like I told you, anything related to small bowel. Small bowel is where all the absorption happening. So when you have a diarrhea, when you have vitamin deficiencies, one after the other, later in your life, you check your blood and you're finding a lot of iron deficiency anemia without any blood loss. So these are some of the atypical presentation, not a typical presentation. And sometimes you can have silent celiac, wherein you have celiac, you don't have absolutely any symptoms whatsoever. It just comes up when you test it. So it is a blood test. Usually start with to see whether you have the antibodies against these components. In a normal population, it will not be positive. So when this antibody comes up positive, in adults especially, we follow it up with an endoscopy and go inside and biopsy the small intestine, which will show whether there is an inflammation going on. How does it look? Does it look flat and not like a typical coral finger-like appearance? These are some methods with which we identify and diagnose celiac.
Very interesting. All right. Let's talk then about why some people can mistaken this food intolerant as just an upset stomach. So like you said, sometimes it's a process of elimination for physicians to try to figure out exactly what's going on. So a lot of these diseases and illnesses can mimic so many other things, right?
Yes, the irritable bowel, wherein when you are in those flared up space in a time, anything that you eat will feel like a food trigger.
Yeah.
Yeah. So
Yes.
that these are some of the confusing things. It's frustrating
Hmm.
both for the treating doctor as well as the patient, that you can't give a clear cut answer, because the presentation, it's not very straightforward to because multiple components are involved. But yes, sometimes it can, in irritable bowel, especially when you are in the wet, flared up phase, all these things can act as a trigger.
And I find personally, I try to eat very little. Like I try to have bland foods, eat as little as possible, nothing that's too rich, to kind of just settle my stomach back down, right?
Mm.
All right. Oh, this is a big word now. You might have to help us with this one.
Yeah, yeah. Just wanted to bring this to the attention, because it is not uncommon. We are earlier, maybe 4 years down the line, 5 years down the line, before 5 years before. Uh, we used to read about this, and rarely, once in a while, we used to come up on this. But we are seeing more of this sort of an eosinophilic gastroenteritis presentation coming up, especially on the island. That's why we thought we will take up this topic. So, basically, this is also a type of food allergy, but not the immediate type which we discussed initially. This is a slow one. Okay. And the same mediators that mediate the runny nose, stuff, the rashes, the cells called as eosinophils. These are normal components of our blood, helps in fighting these sort of allergies, parasites, all those things. But it can go up and lead to something called as a eosinophilic gastroenteritis. What happens is, it could be a food trigger, the common foods like the cow's milk, egg, wheat, some food trigger, and the eosinophil counts goes up and start getting deposited in different parts of your gut. It could be the food pipe. So the presentation could be, you can't, the food gets choked up. You can't even have, the normal food. You're getting choked up. You have to bring the food back up. So we have patients who have choked on a small corn kernel. It starts becoming narrow. Your food pipe, which is a tube, starts becoming narrow, and so these are, you don't expect to have such a presentation with a simple food, allergy or a food trigger. And this is something that can go on for years, and till it's treated. And once you start treating, the food pipe and everything goes back to normal. So some of the most common sites is the food pipe, the esophagus, wherein it can go into a narrowed state. You can't swallow, you can't eat properly. You can have reflux, which is not getting responded to the typical acid suppressant medications. This is something that we are seeing little more than what we were seeing. Whether this is because of increased awareness among ourselves, but definitely we are seeing more and more of this.
Wow. So interesting. Okay. So it might mimic IBS, food tolerance, recurrent digestive infections, and you have to get a proper diagnosis, I suppose, after endoscopy and biopsy.
Yes, yeah. When we do the biopsies, from the food pipe, we all the different parts of the nose, we see the eosinophil numbers are significantly up. So then we know that this is something like a eosinophilic enteritis, and a lot can be done, managed with identifying the food, and the treatment differs. But yeah, this is also a food related issue, and nothing. Though it can sound alarming, like food not going down, the first thing that comes to our mind is there a growth there? But it can be as simple as a food allergen which is triggering this event, and you identify it, you treat it, you go back to normal.
Fantastic. All right. Very, very good. Wow, learning again so much here. I feel like these segments are like sip and learn with Health City. You sip on your morning coffee or your morning tea, and you learn so much information. So, who are considered high risk individuals now for food allergies? We have a whole list here. It does run in families, so that much we know, right? So, if you have a parent who has a food allergy, the chances of your children developing the same food allergy or just any food allergy in general?
In general, it could be a generalized allergic predisposition. That is what
Mm-hmm.
I would put it as possible. Uh,
Okay.
yeah.
Yeah. And then persons with asthma and eczema. Really?
Again, the eosinophils,
Mm-hmm.
these are mediators. So your asthma, eczema could be driven by the same component triggers. it
Oh,
it could be the food trigger which is driving the eczema. So you can have, even the celiac disease can have skin manifestations, and you cut off
right.
wheat and the gluten, everything goes back.
Yes.
So again, the eosinophilic enteritis,
Mm-hmm.
you can have recurrent rashes coming up. So these could all be a common trigger, but
Mm-hmm.
manifested in different systems: the respiratory system, the skin, the gut. So it could be just a different manifestation of the same problem manifesting in different ways.
Mm-hmm. Mm-hmm. All right. Excellent. So, and then persons with autoimmune conditions and persons with underlying gastrointestinal disease as well. Yes. What sort of autoimmune conditions typically do you see go hand in hand with food allergies?
Um, so when you have celiac disease type
Mm-hmm.
1 DM, there is a close correlation.
Mm-hmm.
When so the not the type 2 DM, the type 1 DM, a
Okay.
diverticulitis, the celiac disease.
Ah.
You can have, the thyroid, the autoimmune thyroiditis, vitiligo.
Mm-hmm.
These are some things that we try to correlate between. When you have one,
Mm-hmm.
we try to search for the other. Yeah.
I see. Okay. All right, very good. All right, so sometimes we just live with our allergies. We might take a little antihistamine or something else for the rash, as we do with my daughter. It doesn't seem to be that severe, so she'll just complain about itchiness like around her mouth, and you do see it kind of change the coloration around the mouth. And we give her a little something, and then a couple days later she's fine. It kind of settles down. But there are some people who having a food allergy is a life or death situation for them, or much more serious. So let's talk about now what you should be looking for. How do you know it's really gotten to that stage where it's serious? We've got a list of things here. So persistent or worsening symptoms, that's an indication that you should seek medical attention. Doc, unexplained weight loss. Mm, yes. People don't normally just lose weight for no reason, right? So
Yeah.
we wish. But that can be an indication that there's some underlying issue that's going on there.
So this is where sometimes, in my clinic, I am happy, but the patient is not happy. I am happy when they say I'm not losing weight, but they are not happy.
Mm-hmm. Difficulty swallowing, because again, anything difficulty swallowing or breathing, that would sort of, I guess, be an anaphylactic situation, right? So, can you explain to our listeners who might not know what this term anaphylactic means? What is that?
Basically, it is like how we said, the severe allergic response. Your body
Yeah.
mounts a severe reaction to a particular component.
Mm-hmm.
It
Yep.
can have manifestations in the skin wherein you develop hives, and then you can have manifestations in your upper airway cavity wherein the whole area starts swelling up,
Mm-hmm.
and the breathing tubes, the vocal cords, all these areas can also start getting swollen up, cutting off
Mm-hmm.
your breathe, the breath. So that is a life-threatening emergency wherein you
Mm-hmm.
take the EpiPen, identify, go to the triage immediately. So that is the acute swallowing difficulty, wherein the other swallowing difficulty is the chronic one, which we discussed with regards to the eosinophilic esophagitis. When, because of the allergy, you get choking episodes. You are not able to eat and swallow things that earlier you could easily do. You choke on a meat piece, you choke on bread, you choke on fruits. Such scenarios are something that we need to address, because normal food intolerances should not cause that.
Okay. All right, folks. And any recurrent symptoms linked to foods. Sometimes it's hard to pick up on patterns when you eat certain things, but again, I notice that sometimes dairy doesn't really like me that much. So, I try to stay away from the ice creams and super creamy things. So yeah, pay attention to those, perhaps have them in smaller quantities. And let's talk now about the treatment and management and what you can do with your physician. Dr. Cyril is obviously here to assist you to figure out a program that would work.
Yeah, so the IG ones, the immediate allergies, those can be easily tested on the blood, and you see whether they are up or not. The celiac we can test, the eosinophilic we can test. The in-between ones, the intolerances, these are the ones with, we'll have to work with the help of an expert dietitian, wherein they put you on an elimination diet. They eliminate all the suspected ones. Then 4 to 6 weeks, they try to take you off all the suspected food triggers. Then they slowly start introducing a component. See whether whether your symptoms are recurring or not. So this is what we call as an elimination diet, and reintroducing it, challenging it, oral challenging with the same trigger. So it is a slow process, because some of these things may not come up on the blood testing. It may not come up on the skin prick testing. You will have to do something like a patch test, different types of tests. But most commonly, you try to eliminate it, reintroduce it slowly. It's a task that needs a lot of patience, a lot of back and forth under a trained dietitian, yes. And like how we mentioned, the enzyme deficiencies, that is something that can be diagnosed on small bowel biopsies, breath tests, all those things, yes. So, identification, yes. Most of the time, the patients gives us the answer that I know this is what is the suspect thing, and the food diary, trying to see when you are having the symptoms, go back 2-3 days, think what is it, and then you start developing a pattern. If you can identify a pattern. One interesting thing, I'll just put it here, something called as food dependent exercise induced anaphylaxis, wherein you get all these rashes, urticaria, all those things when you exercise. So this is food dependent in the sense that you have a particular food, and if you exercise within 3-4 hours, you get this. So these can only be diagnosed when the patient comes to us saying, I know my symptoms comes when I exercise. Then you go back and see, okay, do you recollect having wheat, or do you recollect having these things, 3-4 hours in that time period? So it is like a small detective thing, but usually the patient gives the answer most of the time. We just need to keep our minds open for these rare things, yes.
Okay. All right. Very good. Thank you so much for that. And prevention and dietary awareness tips. So this certainly requires you reading the food labels, which, probably any dietitian, nutritionist would recommend that you do anyway, for other health reasons, because there's just so much in the products that we purchase and that we consume that we oftentimes don't know. I keep, trying to encourage my 9-year-old, let's see what's in it. Let's read just for fun. Let's read the labels. And when we see the first 4 items are all a form of sugar, I'm like, yeah, we should probably put that back on the shelf because it's just shocking. Sometimes what you find is in your food. So reading food labels, important obviously for people who have allergies and just general dietary awareness, and being aware of hidden ingredients and cross contamination. So, sometimes they'll have a little warning on there when you go into certain restaurants. This is not a peanut free factory. There may be nuts in there. So, again, for people who have severe allergies, they should be very much aware of that. We've had a couple high profile cases in the last couple of years with American celebrities where they were given something to eat and didn't realize that there were nuts in there, and unfortunately they lost their lives as a result of it. How careful do people need to be if they have that severe of an allergy?
It's very challenging, especially when you use the oils are some of the common culprits that patients report. Even the oil which is labeled as something, they can always be adulteration at different stages. It may not be at a user stage, it could be at the manufacturing stage onwards. These are some challenges, definitely. This is a world that we live, definitely adulteration, improper ways, sometimes as simple as using the same utensils. We had a case wherein in an office someone heated it in the microwave, and the next person who came in, it's as simple as that. You can never be 100% foolproof on this. Accidents will happen.
Wow.
But knowing how severely allergic you are to a particular item, carrying the EpiPen, all those things, yes. But yeah, you can never be foolproof, sadly.
Oh my goodness, I hadn't thought about even microwave use.
These are all rare,
Rare.
but definitely, worth mentioning, because
Yeah.
when we hear it, we always say, "Is that even possible?" But then when you go back, yes, it's possible. So it's always a learning experience for us also.
Right. Okay. All right. So cross contamination, introduce dietary changes under medical supervision where appropriate, and avoid self-diagnosing. This is a thing I think we all do. Restrictive diets without evaluation. So this is where you want to see a physician to try to narrow down exactly what's going on, because you might be making your situation worse, Doc. I can imagine. Yeah. If you're trying to self-diagnose.
You're taking out, my main worry is in children when we try to, restrict a lot of things, assuming that this is the culprit. You take off milk, you take off egg, what are they left with? They're not getting the sufficient protein. They're not getting their vitamins. They're not getting their fruits. We take off everything and try to put them on a restricted. So such restriction should usually be taken under the guidance of a pediatric or an allergic specialist or a dietitian, so that you have a structured plan on what to do what for. The cow's milk I mentioned, you start having issues while you're a child, but you can definitely reevaluate later in your years, whether you're still allergic to that, whether you can tolerate a glass of milk. All those, yeah. So the lifelong avoidance based on
Self-diagnosing, yeah. Let me ask you a question about milk. And I see aisle 2025 is in the comment section that says, just tuning in, apologies. I think I'm lactose intolerant. Can I get the testing done at Health City? And what's the estimated cost? So how do you test for lactose intolerance?
So different types of tests are there. Something we can have indirect tests like breath test, or if you want to have a specific testing done. So these are enzymes which are there in the small intestine. So you can do an endoscopy, take biopsies and check for the specific enzyme.
Okay.
You are deficient. Yeah, we know you are deficient. But the other way would be checking for breath test. These can also show us whether there is a rise in glucose levels, blood test, or whether there is a rise in your, when it is not absorbed properly, your hydrogen goes up. These are blood tests. These are markers which show us that, yes, you probably have a lactase deficiency. But the specific one would be the biopsy from the small bowel, which can give us an answer whether you are deficient in that or not.
Okay. And Aisle 2025 saying that would like a full allergy workup. Sometimes not a bad idea. I did a few, I was having sinus issues, but I did one a couple years ago where they did the skin test for environmental allergies. And then, and that can pick up on some food allergies and stuff as well. So typically speaking, no food allergies for me, but thankfully, but definitely quite a few environmental things. Like I think most people are allergic to dust mite. Like nobody likes dust mites and stuff like this, right? And some pet dander and so forth. But folks, contact Health City. 640-4040 is a telephone number. You can always email them at info@healthcity.ky. And of course, their website has a list of all of their experts, healthcity.ky. And you can get the app, which I've downloaded but have yet to use. Don't tell Shamari. And and so you can book appointments and stuff right from the app as well. So Aisle 2025 says, I get very sick when I eat pretty much anything, and ice cream is my favorite food. So sorry. With milk, ice cream, I feel the worst. Yikes. So maybe you need to definitely go in and see Dr. Cyril and see if they can't get you sorted out. Is there a medication that I know you can do, obviously, things that have no lactose in it, but can you also have a medication that allows you to tolerate the lactose so you can enjoy your favorite ice cream every once in a while?
These enzymes are available. There are not only for lactase. There are other enzymes like maltase, sucrase, which break down basically carbohydrates. So there are pills available, ready-made enzymes. Some brands called Similase, a lot of brands. Basically, these are enzymes which comes as a capsule form, which you can take.
Okay. All right, wonderful. But go see Dr. Cyril, Aisle 2025, and see exactly what is going on with you. Does your body, this is just a curiosity question, but I'm not a big milk lover. So this is really weird. I mean, I love cheeses and obviously everybody loves ice cream, but I don't actually hardly ever have a desire to drink milk. And I've always wondered if that is somehow tied into maybe I don't tolerate milk that well and I just don't care to have it. Every once in a while, you have the right, like if you have a nice brownie, you feel like, brownie and milk, perfect combination. So I might have a little bit of milk to wash down the brownie, but we could have milk here for months and I don't touch milk directly. Obviously, dairies and a lot of other things. But is that an indication that maybe there's something going on there with me and milk, or is it just that, sometimes you just don't like a particular food all that much? Or does your body tend to respond in a way that it will almost have you not desire a particular thing if it's giving you some issues?
Possible, the avoidance method. Your body tries to avoid something that it knows subconsciously.
Yeah. I've always kind of wondered why I don't really care for milk. Like I don't crave milk. Some people are like, oh man, I could have a good cold glass of milk right about now. And my daughter she would drink milk every single day if she could, because she loves milk. But yeah. All right. Well, Dr. Cyril, folks, in the studio with us today, talk about food allergies. Obviously, we covered quite a bit of ground. Shamari, do you or anyone in your immediate family have food allergies?
Yes. My wife has some allergies.
Okay.
She can only have 2% milk. There's there as well, and I think I need to book her in for Dr. Cyril because she has been complaining for quite a while, and she keeps trying new things, and same thing, removing things from the diet, and then sometimes it comes back up and her ears itch and she makes that good old Caymanian noise where they scratch their throat. that I can't even do it.
I know, neither can I. And it bothers me so much when people do it. I'm like, nah.
But no, definitely. So luckily, I think Isaiah probably grew out of his intolerance when he was younger. He couldn't have cow's milk, and even when he was coming off the breast, we had to figure out, for some reason, goat milk was the only thing that he could actually drink. And then eventually, so he doesn't really like dairy, but we don't know it because, from a young age, he didn't really have it because he couldn't keep it down. But now, even things that you would think like mac and cheese and whatnot, he's like, he doesn't want that, right? So he likes solid breads and whatnot, but anything milk, even cereal, he doesn't like cereal. But we don't see any reaction. We just think he probably associates it with what would have happened previously. But yes, at least 2 people in my immediate family have some issues that definitely need to give a visit to Dr. Cyril.
All right, wonderful. And of course, I've known people. I was fortunate we don't have anyone. Like I said, well, being allergic to Chick-fil-A is not that big of a deal because we don't even have one here. So it's only when we travel and she feels like, oh, Mom, can I get some Chick-fil-A nuggets? But yeah, we don't have any other allergies that we're really aware of. But I know of people, sometimes kids in her school, they have severe allergies. And if you're sending, goodies for the kids to celebrate birthdays, whatever, they're like, no nuts. And I'm always so paranoid. I'm like, oh my God, I don't want to take any responsibility for there accidentally being, nut oil or something in there. So, reach out to Dr. Cyril. Obviously, if your kids do have are presenting symptoms of continuous or more severe allergies, parents and adults as well. Sometimes we try to live with a situation, but you don't have to live in discomfort or pain. That's what the physicians are there for, to try to, give you some resolution to these problems.
Definitely. Thank you, Dr.
Wonderful. Yes, thank you so much. All right, so that's Dr. Cyril and Shamari, who, as Johan said earlier, is not a doctor, but he knows so much and he can pronounce a lot of big words. We feel like he's doctor adjacent. Have a great day.
See you next week.
All right, thank you so much. Okay, so that was interesting. Live Happy says, I don't drink milk either. As humans, we should not drink milk. Milk is for calf, not even cow's milk. So why should we? Well, I don't know about that. Why would you say that we shouldn't drink milk? I mean, don't you eat turtle? Are you trying to say you shouldn't eat turtle either? You shouldn't eat conch? I mean, there's lots of things that are, human beings have adapted them as part of our diet, right? So I guess you could say that probably about anything, really. Any form of milk, but milk has, I think it's an easy form of certain nutrients for human beings. So yeah, I mean, as a baby comes out, they're getting human milk, and then sometimes they can't, for whatever reason, get that. And so you have other milk alternatives for them. All right. Very good. Good discussion this morning. Thanks to Johan and some of the other callers who are now in jail. We have developed some wonderful disclaimers, and I'm going to now play one of those for your listening pleasure to just remind people of all of the rules that we have.
The views expressed by callers, guests, and contributors on The Cold Hard Truth are their own and do not necessarily reflect the views of Cayman Marl Road, its management, sponsors, or affiliates. CMR encourages open discussion, but all participants are responsible for their own statements. Please speak truthfully, responsibly, and respectfully.
All right, good stuff, honey child. Everybody's good? Wonderful. So yesterday's show, what a hot mess. I had to cover some ground dealing with, you guys know who. And yes, I'm a woman of my word. So, just adjusting. Gonna sit for the rest of the show. Did the first hour and a bit without my chair. So, I'm a woman of my word. So I made some comments yesterday in terms of what my actions would be legally and what I would be doing. So all of you can rest assured that that situation is well underway, and we should make some significant progress today in terms of getting the documentation filed and then getting her served, because she is in Cayman Brac. So we don't fool around with certain things around here. And those of you who reached out with additional information, I do appreciate you doing so as well. Thank you very, very much. And I'll keep you guys updated and abreast as we go through this unfortunate but necessary, situation. All righty. So we're going to talk about a few things that have been happening in the community. It was really, I didn't get to touch on this yesterday because I wasted time having to deal with that particular situation. And so there's a few other things now that I do want to talk about. The fatal stabbing in West Bay, which Saturday morning we became aware, unfortunately, that Mr. Kenneth Christian had passed away. I was really, really shocked and surprised by this. I'm going to tell you the truth. I didn't expect it. I knew that his injuries were serious. And I know I kind of, like, when I reflected on what my initial thoughts were and what I actually said about it, if you guys were listening to the program, you'll remember that I actually said that, at a particular age, it becomes difficult for your body to sustain any sort of trauma. And I suppose that, in the moment, my mind was thinking about this, receiving, a stabbing in the head, in the neck region, injuries to his ear. Yeah, your body at 25 versus your body at 70 something responding to this is very, very different. So he had sent a message by way of someone for me. He was 78 years old, by the way. And he had sent a message on Friday. He had come out of surgery and he was obviously feeling a lot better. And he sent a message essentially saying that I could stop by and chat with him and visit him. And I wanted to do that. And I was actually planning on doing it sometime on Saturday because I was going to Austin, Texas on Sunday. So I knew that Sunday my whole day would be, focused on that trip. And when I woke up to messages that said that Mr. Kenneth had passed away, I honestly couldn't believe it. I was just like, what? So first of all, let me extend my condolences to his family. This has had to have been such a horrific ordeal for them. Wow. Just unbelievable, quite frankly. And now the police have indicated yesterday that they have the butcher, who is Drayson Watson is his name. He has been arrested and charged. Now, so far, he's only charged with wounding. And there were some people messaging me yesterday who weren't quite understanding this. So I think that maybe it's worth spending a little bit of time explaining how this works and probably why the only charge at this point is that particular one. So they did indicate in their press statement that they're waiting on the coroner's report before they then proceed with any additional charges. So, one of the things with the RCIPS is a lot of times they are often accused of, rushing to judgment, so to speak. So I kind of feel like in this case, they want to take their time so that that's not going to be one of the arguments that the defense is going to lay. And I suppose it's possible, although it would be somewhat of a rare situation, but it is possible for someone to be involved in an incident like this, but then that not be the cause of death, right? So the medical professionals, the police are not in a position to say what the cause of death was. The medical professionals have to indicate what the cause of death actually was. I understand, again, and I think what makes this a little bit more challenging is that he had his initial surgery and then he appeared to be okay, and then he died after that. So, this is where law and medicine intertwined. Things get a little bit tricky, because, was it like his body was under so much stress that it led to heart attack? And, but there is a principle in law that you take your victim as you find them. So, for example, if you attack an elderly victim with pre-existing conditions, the legal system is not going to excuse you from a murder charge because you didn't know that that person had pre-existing conditions. The position that the law has taken, criminal law, is that, you take your victim as you find them, because you should not have been stabbing the victim in the first place. You should not have been, robbing the victim or whatever it was that led to their death. So that's one thing. But there are other possibilities. Someone just said, he could have died because of the HSA. I mean, yes, you cannot jump to an immediate conclusion. Oh, poor thing. Yeah, you cannot jump to an immediate conclusion in terms of the cause of death. The medical people have to tell you that. So they will now undergo. I mean, I understood that it was in some sort of internal bleeding that occurred. But, what if he had an ulcer that had nothing to do with this and it was just a coincidence in timing? So make them go through the process, because I can tell you what, lawyers think of everything when they are mounting a defense. And so it is important that the case is as tight as possible. It could mean the difference between charging someone with a murder charge versus a manslaughter charge, and different things that you would have to prove that actually occurred. So someone just mentioned that his leg was also broken and that he went through a lot that day. What I do know, is that this whole thing is just incredibly unfortunate. We have here now 2 Caymanians. The first one is, obviously Mr. Kenneth, known as the medicine man. A lot of people knew him in the community. And the other guy now here is this Drayson Watson, also known in the community. And so 2 Caymanians involved in this situation, which is really, really unfortunate. So Drayson Watson is 47 years old. And he was initially arrested for murder on May the 23rd, following a wounding incident that occurred on Wednesday, May the 20th. Well, that doesn't make any sense. He now faces 4 charges. I got to double check that. Wounding with intent, possession of an offensive weapon, and possession of a prohibited weapon. So I see what they did. Okay. So they initially arrested him. So, when they arrest you on suspicion of something, right? So they did that, but they only at this time have charged him with 4 things: wounding with intent, possession of offensive weapon, and possession of a prohibited weapon. And they say that the charges remain preliminary pending the outcome of a postmortem examination of the deceased. So once they determine his cause of death, and if it was in any way connected to the stabbing incident, yes, the charges will then be upgraded, if you will. So, yeah. All right. So it's just really unfortunate. I mean, I'm hearing all sorts of things on both sides of the spectrum here. I have seen video footage, which I'm not really going to share with you guys, of the incident. And so, I think that both individuals did things that escalated this. And this is why I want to say something here, right? Sometimes you just have to know when to walk away from trouble. Know what we say here on the show sometimes? Don't trouble trouble if trouble don't trouble you, right? There is a sense that this could have been completely avoided. Mr. Kenneth did pull something, in this agitated argument. Drayson could have just kept walking and walked away. He decided not to. So there's so many intricate elements to this that make this, I think, very, very unfortunate. I think that when you pull something on someone in a moment like this, it is considered a weapon, whether it is a piece of wood or whether it's a machete or whatever. And then you have to know that not everyone is going to respond to that by just walking away, you know? So sometimes we have to just be careful. The arguments that we find ourselves in, the situations, to lose your life over some argument over turtle meat is just wild and crazy. Now, I do understand that Mr. Kenneth, he was feeling so good on Friday. Apparently, he put some kind of post on social media. I was not Facebook friends with him, but someone did mention it to me that he posted up something, and there might have been some argument there, some accusation that Drayson was somehow profiting from the sale of the turtle meat or selling it on the side or some mix-up story. What I do want to say to the Cayman Islands Turtle Center, I feel like this is a warning to the board and the management at the Turtle Center, because I understand that recently they changed how you get your turtle. So it used to be a situation where you called in. You called in and ordered, or is it the other way around? Somebody helps me who buys turtle. I think you had to show up or something. Now you call in and reserve it. But anyway, they've changed it. And so, because there were some people who I think were seemingly getting preferential treatment with the turtle, and then there was like infighting with that, but they were changing it to have it where the butchers were not setting turtle aside for people. You know, it's kind of more on a first come, first serve basis. However, it seems like that is still happening. People are still kind of doing it probably under the table. Like, give me a little $25 and I'm going to you still call me, you still WhatsApp me, and I'm going to set it aside. So I do think that the turtle farm needs to have very, very firm procedures, whatever your ordering process is. You need to have firm procedures in place so that people are not there fighting over turtle meat. I mean, that's just crazy. Like, what the heck, right? It's certainly not worth someone losing their life over this. Now, someone has basically died on turtle farm property because of foolishness over turtle meat. I like turtle meat, I suppose, probably not as much as some Caymanians, because I don't really eat it that often. And I only eat lean meat, but every once in a while I'll eat some turtle. I understand it's our national dish, and I know some of you are very, very protective of that as our national dish, and you feel like you have a right to eat turtle. Would I feel bad if they said, listen, not that we're going to ban it completely, but we're going to reduce the amount of, because even the farming of the turtles is an issue, because some of them are, in those, not the biggest containers in the world. They've been hit by diseases over the years. They've had all sorts of issues. I get the reason why we do it, because we're trying to curtail and cut out the poaching potential, right? So I understand obviously the issue of farming, the reason why we farm them and make them available for sale. But the Turtle Center, as it's now called, previously the Turtle Farm, also you should know sells that turtle meat at a loss, because it costs a lot to get those turtles to adulthood where they are available for slaughtering. So in fact, it is a delicacy to be able to eat turtle meat. And every single one of us, every single Friday, y'all be out here like, I need my Friday turtle meat. Yeah, I want my Tuesday turtle meat. Like, you want turtle meat every day of the week. And so I think at some point we need to have an honest conversation about how, yes, we're encouraging people. We don't want people poaching them. But the truth of the matter is we are actually, negatively impacting the turtles, even by eating them ourselves. And so do we at some point have to make a decision of, maybe as Caymanians, our traditional turtle dish no longer can be eaten? My mind goes back to when I traveled to the Galapagos, right? And there are things that you can say historically that we have done. Oh, but Sandy, this is our history. And we have done this for forever, for hundreds of years. Came on, we had turtlers and whatever. And I hear you, but I also know that things have changed over the years. And so, yes, we want to do all sorts of things because we just get used to doing them. And that's, we want to continue to do them. But what I also know, folks, is that our desire to continue to do something just because we've always done it is hurting the environment, hurting Mother Nature. And so perhaps it is time that we reflected on our behavior and made some decisions about, is this in the best interest of the turtles themselves? I know it's hard. And like I said, this was making me reflect on when we went to Ecuador. There was one section with the indigenous people where they were showing us how they make these instruments, right? These, they're kind of like little wind flute looking things, looking instruments. I forget the proper name for them. And so historically, passed down from one generation to the next, they actually, show you how they make it, right? So the lady who was demonstrating, she learned the craft from her father, who learned it from, his parents, his father, and it goes on from one to the next. But they showed us something which I thought was very, very interesting. And that is, at one point, they used to make some of these instruments. I'm just trying to see if I can find a picture here quickly to show you. They used to make one of these instruments from the backs of, oh Lord, what is this animal called again? The armadillo? Yes. So they used to make them from armadillo shell, and they actually have an armadillo up on the wall when we were there. So of course I took a picture of it. I'm like, oh, wow. And they said, no, now that's outlawed. So they're not permitted to do that anymore. And yes, here it is. I'm going to show you guys this little armadillo. Okay, hold on. And so I was like, really? And they said, yeah, for hundreds of years, probably thousands of years. That is how they made the instruments, from little armadillo shells and whatever. And, they realized that they were actually, making them extinct. Like they were hunting them to extinction in order to make instruments. And so sometimes we're doing the exact same thing for food. Like, oh, we got to have that turtle meat, but we are actually, here's a picture. Here's an armadillo on the wall that they had on display. But we are actually doing more harm to the environment than not. So this little guy was used to make these instruments that you see that are surrounding him. And now he is just a display on the wall. Here's a picture of how they would use the armadillo parts as decorative pieces on the instruments. And so now it's illegal for them to do that. And, I can only tell you that during the lady's presentation, she explained to us that they no longer use it because it is against the law, and they understand why, because the armadillos were just completely disappearing. So these are the little wind instruments. I forget the proper name for them, but it was such an interesting demonstration that we had in relation to these. I bought one little instrument for Gigi that you have to put water in it in order for it to work. It's like the cutest little thing. But these people still have, they found alternative materials. They found alternative ways of doing things. Even when we went to, there was another indigenous trip where we had, they were making like an alcoholic beverage, right? That they use like at weddings and celebrations and stuff like that. And so when they were talking about how they ferment it and how they make it, at one time they actually used to put, here she is, showing you how the instruments are made with the different types of, wood, and how they make the holes differently and whatever, depending on the sound that they're going for. But yeah, when they were talking about, they used to put saliva in this thing to ferment and to drink. And then of course, after a big outbreak of something like COVID, they're like, oh, yeah, we can't really use saliva anymore because obviously we know that saliva carries, a person's spit can carry all sorts of things, Ebola, COVID, all sorts of diseases. So traditionally, that may have been the way of doing it, but now they know better, right? So when we know better, I think we got to do better. And all I'm saying is it is worth considering how we are impacting the environment, our overfishing of the oceans. Lobsters used to be, when we hear about our forefathers talking about they didn't have to go out in no boat to go no diving for lobster. Like they put their hand in the ocean. It was basically there for them to grab. That is no longer the case. So the negative impact that humans are having on the environment, I think, is a consideration at all levels that we sincerely need to think about. And how does that impact the decisions that we're going to make? I think there's a lot of tough decisions when it comes to sustainability that we do need to consider. If we want to have turtles around in the environment for, future generations to even know what a turtle is, maybe we really need to think closely about what it is that we're doing. Now, to be fair to the Cayman Islands Turtle Center, they do have, their breeding program, and they do release a lot of turtles. And we know that those turtles come right back home, so to speak, to where they were released from, where they were born and where they were released, to then continue their reproduction cycle over the years. And, I'm just saying here that as I thought about this fight over this turtle meat, there's a lot that was going through my mind, including some of the things that's happening at the Turtle Center in terms of the management of the selling of turtle meat, how we as Caymanians see turtle, whether or not we wish to, have these things go into extinction completely, or are we willing to make the necessary sacrifice to preserve them? Owl 2025, good morning again. Says, which MP is responsible for the turtle farm? I think it would be the Minister of Tourism, but I'm not entirely sure. I mean, I feel like that's normally who it is. So it's probably the Deputy Premier. I'll confirm that though. Anthony says the turtle meat and distribution of it needs regulations. It should be only culturally identified restaurants should be receiving it commercially. Not every Jamaica cook shop and car back selling it. You see, this is what I'm talking about. Is there a way to now rein this in? What I can say, though, is because we have allowed it to go for so long without any regulation whatsoever, I do feel like it's going to be difficult, certainly not impossible, but it's going to now be difficult to rein that in because it's big money to have turtle meat on the menu. So yeah, this person says, done it for years. Now they gone. It's mostly elderly Caymanians that purchase turtle meat, a few Jamaicans, but it's mostly Caymanians. I mean, I don't know about that because it's on every single menu. And as Anthony said, Jamaican run shops have it on the menu as well because they know that people like to eat it. I don't know if Jamaicans love turtle meat, but I know for sure Caymanians love it. And Caymanians are frequenting, the little Jamaican corner shop restaurants and whatever, probably more than the Jamaicans are sometimes. But yeah, I mean, it's on everyone's menu. So how many, I would be interested to know some facts around this, like how much turtle meat is being butchered and sold every week, and who it's going to. Maybe that's an FOI question. We could find out. Abby says the day we can't eat turtle meat is the day we've lost Cayman entirely. Well, what if you can't eat turtle meat because we eat them into extinction? Are you going to then say that you're not Caymanian because something you used to eat has now become extinct? I don't think so. I mean, you have to balance this. It's like saying, the buffalo in the US, if this particular animal is gone, which has always represented the indigenous Americans, if that goes away, Does that mean that there's no longer a U.S. or an American? Not really. There's lots of things that have become extinct. The American bison over the years, right? So the American bison is obviously endemic or native to North America. And yeah, there are things in our lifetime that will go, I'm thinking about some of the other animals, even like on the African continent and other places that have now disappeared completely, and that our children will never be able to see anything but, oh, here's a photo of it. Oh, this is the last, rhino, whatever, because, human beings basically hunted them into extinction. So now your children's children will only ever see that in a photo. Once upon a time. All right, Island Pearl says, no, sir, I don't know what I'm going to do then, because I need to have me some turtle at least twice for the month. Really? I'm probably going to just have to raise and grow my own turtles from now so I can support my eating habits. You are not going to be growing no green sea turtle, that's for sure. You might have a little hicatee. Do people eat hicatees? Is that a thing? Does it taste the same? I'm curious. I mean, does all turtle meat taste the same? So does it matter which turtle you get the turtle meat from? I honestly don't know. Ja, I don't even know how you pronounce that name, says maybe make it seasonal and find a better system for selling it. Adriana, thank you. She said that drink is called chicha. That sounds about right. And they made some minus the saliva that people could partake of, but you guys know that I don't drink. So I was like, irks. Morning, Sherry. Anthony says absolutely 100% regulate the distribution and preparation. Lady D says they need to do the order / payment online, that people just show up with their online receipt as proof to just collect their turtle meat orders, stop people from calling in orders. So like I said, there was some sort of change recently, understanding how it's done, and people still doing it the old way and all kind of mix up and under the table business that's going on. So I do think the Turtle Farm, Turtle Center needs to perhaps make sure that there's full compliance, but when you have people there wanting to do whatever they want to do, regardless of what the rules are, then you got a problem on your hands. Sia, good morning, says the only alternative to green turtle in Cayman is Hakati turtle, and we don't have enough of them either. I've never even heard of them. Where are they from? Sia says we soon start making 3D printed turtle meat. Yes. Tartarian says I saw the Filipinos showing off sprats on Facebook, buckets of them. It needs to stop. Oh, God. Dawn says, me love it. Lady D says, not everybody knows how to cook turtle, to be honest. Abby says, that's why we farm them for sustainability instead of only hunting wild turtles. Hello. But what I'm telling you is the farming of turtles is not as sustainable as you think. That's what I'm saying to you, Abby. They farm them at a loss, first of all. But the argument is, well, that's the loss we're going to take to try to not have people go after them in the wild. But there's other things around that when we talk about sustainability. There was a whole time, and I don't know if they even have it under control yet, but we were basically farming diseased turtles. Yeah. And the what do you call it? Their reproduction rate had dropped significantly as well. And so there was a problem with that. El Rey says, I only eat turtle cooked by Caymanians. Yeah, I mean, you might be going to a Caymanian restaurant, but do you really know who's in the kitchen? All right, 1 second. We got a call in the line.
Want to join the conversation on the cold, hard truth? Call us live at 345-936-2626. Before calling, Please remember, no profanity, no personal attacks. Stay on topic. Respect differing opinions. Keep your comments brief so others can participate. CMR reserves the right to disconnect calls that violate our community standards. Now let's get back to the conversation.
All right. Good morning, caller, and welcome to the program, Honey Chill.
Yeah, morning, Sandra.
Morning, dear.
Yeah, sure. I know your topic is on the turtle meat, the turtle, situation, and that's what I always hear you say, a hot mess.
Yeah, sounds like it.
Remains to see how that all pans out. But since we're on that, and they're like, I will try to comply with all your. When I call, I always try to be constructive if I'm going to criticize, not to ridicule, condemn, or disengage someone, because I know the situation is that we ain't living in a perfect world. We don't have perfect people running it either. But there is a glaring issue here that seemed to be terribly overlooked for many years. The problem didn't start with this government, but it just so happens that all our woes and ills that we have, seemingly everyone's going to expect, or most people going to expect them to fix it, the present government to fix it. It's just the harsh reality. Heavy is the head that wears the crown.
Right.
From whom much is given, much is expected. Now, what I'm talking about is the fishing situation, the depletion of our marine life in general, but the fish especially. If you just bear with me, can give me a few minutes, I'll explain some things and I'll use some references. For instance, we here apparently is dependent on the second pillar of economy. I always heard that is tourism. Now, if you look along the shorelines of Cayman Islands, you see a lot of rocks that is bleached out white, and a lot of people don't know what the cause of it is. But what it is, that is a living organism that is dying or dead. And the cause usually is there's not enough juvenile fish any longer, of the algae, the moss, as we say so in Cayman. And therefore, that coral doesn't get adequate sunlight and oxygen, thus it die. You don't think a lot of people that's coming here as visitors knows that as well. They know, we live in the prehistoric times, and that's not a good look on us to start with.
Yes.
And no one's come here to see the Dead Sea. They'll go where the Dead Sea is if they want to see that. But thing is, for someone to, you see, you eat fish, right? Okay. Now remember, we'll always have fish, I guess, from somewhere else. But what about the generations coming? Should we be able to preserve something showing what a red grunter or a lagoon snapper look like?
Yes.
Okay. Thing is, though, the smaller fish, when they're all caught off, a lot of the bigger fish goes somewhere else because the smaller fish is the food chain. And once they disappear, the big fish will too. There's certain species of fish I don't even see anymore, And you know what's bad? Extinction is forever.
Yes, most certainly.
Okay. Now, it was supposed to be something apparently being debated about this situation with all of the, infringement and depletion of our marine resources. But no news is good news. I haven't heard anything, and that was from last year, September, October. That was supposed to be coming in effect. Yeah, I got that from the horse's mouth.
Well,
Okay.
I mean, just because we haven't heard anything about it, I suppose, the sustainability ministry, I'll tell you, when they had that chamber luncheon recently, these were some of the questions that were being asked of people who attended. Some are environmental groups and others are just individuals who are very, very concerned about the overfishing, whether it's of grouper or all sorts of other.
It's good to know.
So I think the ministry has to give us more information on what it is that they're doing when it comes to
No news is good
sustainability.
news, Sandra.
No news.
No news is good news. And bear in mind, I mean, what it leads to a lot of speculation. You know, an assumption, what that is, the mother of all mess ups. But let me finish by saying this. Since I guess I got the point across. The thing is now, someone who used to live in Bermuda for almost 10 years told me they were going through the same thing that we were going through here. You know, being, you know, where they have a lot of transient workers coming and go, you know, same type of industry that we have, per se. And it came a time when the Bermudan government actually had to get up and say, well, you know, we can't afford this any longer. Enough is enough, but too much is too much. And they initiated a law to protect their marine ecology, all of the marine life. Listen, brace yourself. For 10 years. Very extreme. This seen extreme situation required extreme measures. But a lot of people didn't agree with it, apparently, you know, because they got so used to, you know, being able to, you know, come as you are and go as you please, come and go, do whatever they want to do. And they was imprisoned. Some had to pay half the fines. But within 2 or 3 years, the message got across. Within 2 or 3 years, there was, the sea was bountiful again. And all the creature was because of that replenishment time. So, you know, it is high time that we do, because as you speak, as me speaking, there's someone out there, just, you heard pictures of these Filipinos, just, you know, it's a known fact, catching all this juvenile fish, you know, all the sprats, whatever, fries, and that's a food chain of bigger fish, right? And it has a lot to do, look at the parrotfish. Parrotfish is one that makes the beach, right? And they're hermaphrodite, you know, they can change if necessary from one species to the next, you know, like one sex to the next. But if it's not enough for them, they ain't be able to do that either, no matter what. So it's time, high time, big time, necessary. It's an indictment if the government doesn't do something, and soon. Sandra, with that, thanks for giving me the opportunity on your platform, and you keep up the good luck. Shining the lights bright.
Thank you so much. I appreciate it. Some very, very interesting comments there. I mean, listen, point well taken. And this is kind of, you know, what I'm saying as well, is that sometimes governments have to step in and do things that make them unpopular, but it's the right thing to do. Right? That's why we hire them, right? To make the tough decisions. And sometimes we, the general public, don't even like the tough decisions. So there's something to be said, though. You got to have the gumption to be able to get it done. Yes, honey child. So the question then becomes, is it time for us to do a little bit more to protect our turtle industry, or turtles, first and foremost? Just like before, you know, you used to be able to go get turtle shells and all kind of stuff for decorative purposes, hang them on your walls. That's not allowed anymore, because again, we need to stop people from poaching them. This one says, good morning, Ma. Oh, sorry, that part. Then somebody says, since this happened, I heard a lot of West Bayers saying that Drayson was selling it outside of the work, not at the farm. Everything is going to come out now. Like usual, something has to happen first. It's just so sad that this had to happen. All right, we got another caller. Good morning, caller. Welcome to the program.
Good morning, Miss Sandra. Trust you're well.
Good morning, darling.
Well, I'm going to ask something of you, please.
Sure.
If you could do sometime soon, reach out to the DOE and ask the good folks if they would come on your show, and so that we can talk about what that gentleman just talked about. I tell you the reason we have to do it, Sandra. Our coastlines are being overfished, just like the Caymanian gentleman talked about. Once all of the small juvenile fish have gone from the iron shore and the coast, then the big fish disappear. because they have nothing to feed on. What I see taking place, I call it as I see it. It's not only on Northwest Point Road, the Iron Shore, coastline, what we call it. It is being overfished, just like the commenter, Mr. Tartarian, said. He saw Filipinos selling parat by the bucket. These are 5-gallon pails, okay? 5-gallon buckets that paint and all of this stuff come for construction. He's not lying, Sandra. He's not lying. They have stripped down by where the old Spanish Bay Reef Hotel used to be on Conch Point Road. We called it that area all down there. It's called Barkers. Okay? They go down there. They go with 4 and 5 rod and reels. One Filipino comes with 4 or 5 rod and reels. Okay? I watch it daily in the evenings too. Down here on Northwest Point. Then they got 2 or 3 hand lines. The Jamaicans are doing the same thing. They're taking everything, Sandra. Everything. The archer, everything that they eat where they come from. They are stripping our coastline. And when you talk to these two nationalities, the Jamaicans and the Filipinos, they go off on you. They go behind persons. You know how we have allowed the destruction of the coastline and the Iron Shore by building cement walkways down to the edge of it? People have homes down here in Northwest Point. Some of them are not occupied all year round. They go back there. They go through people's properties. They don't care. I see this all the time, every day happening around here, Sandra. The government needs to come up with whatever solution they're going to come up with. It was talked that foreign nationals that were here on work permits were only soon supposed to be able to fish and release, not keep anything. Something has to be done, whether it's a moratorium on taking fish like Bermuda did for a while, because we have it with the groupers. And I can tell you, I raised up in the Brack, Sandra. I know what fish look like. I know what turtle look like. I know they were plentiful. Okay? I don't eat turtle anymore because I think that is one of the reasons Caymanians are getting cancer, okay? Because of the man-made food that they are being fed. I ask anybody, take a drive if you can this weekend or something. Come down to the Turtle Farms parking lot, okay, Sandra? And you will see it littered with people on the bike fishing. I don't eat turtle anymore, but I've eaten it all my life. Wild, we used to raise them and kill them when I was young in the Brack. But the destruction of the coastline, of the marine life, and I'm bringing light to this because I see it. There is a certain apartment complex, Sandra, on Conch Point Road just before you get down to Papagallo Restaurant and turn to the right where the road, I think, is Power Road, because that's where a lot of the Powers live down in there. That's why that road is called that. On the left, it is after the Pampered Ponies. It's an apartment complex. It's a building. It's just one building with about 8 apartments. It's loaded with Filipinos and Jamaicans, and you know what they have been doing? All of the young juvenile counts, Sandra, that comes in to feed, and all of the fish that come in during the day to feed on that turtle grass that they eat, they are stripping that area down there of all the juvenile counts. And there are not enough DOE officers to do the job in Cayman. And we need the government to address that problem. We need whoever, the minister that is responsible for it, and the minister, we need them to come forward with a plan, Sandra, because I'll tell you this, why it is urgent. You see tourism or pillar that runs this economy, just like financial services. You remember when the 2008 financial crisis happened, it affected the world. Cayman got affected too. Okay? We know about overfishing in the Caribbean. We know about it in Cayman. It is happening daily. And Caymanians have to take a stand on this, because if we want something left for the next generations to see and to know what we did, we are going to have to implement a system of banning foreign workers that come here from fishing. I am sorry. When they leave, what they have done is continually stripping our coastline. And if the coastline gets stripped of all of the marine life that is needed to make it grow, you know what's going to happen, Sandra? Just like the gentleman say, the young juvenile fish can't get the algae to kill it, so the algae is going to grow. Do me a favor this weekend. Come down by the Turtle Farm parking lot. It closes at 7:30 when the security puts the sheen on, okay? To stop people from going in, but they're walking back and fishing anyway. That's a different story. Come back there, get out of your vehicle, and listen to the water rushing from underneath, from across the Turtle Farm, through the road, under the parking lot, and you will see the water gushing out to the back of the cement wall. There's 2 or 3 pipes that come out there. There's algae growing on top of the iron shore now, because that is man-made feed. The water is dirty. You know, when you wash dishes or you wash a load of clothes and the water coming out is soapy and frothy and dingy looking, brownish like, that's the type of water that is coming from the Turtle Farm, okay? And it's coming in 3 pipes and coming straight out into the Caribbean Sea. And I'm sure it's treated, because it has to be, I'm sure, but it's steak. I don't know who would eat turtle after smelling that nastiness, but I stopped it years ago. People are back there fishing. Those fish are nasty to catch back there. They're eating all that nasty stuff that's coming out of that, into that water. You know, no. I don't, if the depletion and the stripping and the continuation continues of taking the juvenile fish and every other marine life that is scattered around our iron shores, you know what's going to happen? Eventually, there's going to be none. Give it 10 years and we will be hauling a different story. And you know what that story is going to be, Sandra? The long, winding road down of the trickle-down effect. We allowed persons to come here, live here, and do as they feel to our coastline and our marine environment. And now there's nothing to see when you go down there as a snorkeler or a diver. So then what happens to our tourism product? It goes away, Sandra, because nobody's going to come to an island to dive or snorkel. We might have beautiful beaches and friendly people, but we don't have what they want to see and experience, marine life. So then therefore the tourism product of diving dries up. And what effect that has? The dive shops have to close, the dive operations have to close, and people get laid off.
Yeah.
That's the trickle-down effect of not protecting our environment. So I'm asking you as one Caymanian that takes what is only needed when wilks and conchs is in season. Just one time I go, that's all. I don't take any more. I take what I'm allowed. I go 1 or 2 times and I have enough for the season because I give them a little half a pail of wilk. I clean them. I go back 2 or 3 weeks later, I get my other little half a pail, and I got enough to carry me through the season to eat it and cook it. That's how I do it. And I buy my conch when they're in season. I only buy them from people that I know that do not go and strip the shorelines of the conch. Because there are people here that strip them and don't care. But there are a few Caymanians that abide by the law, and those are the ones I buy it from in season. Because if we do not do what we have to do to protect this marine life, there's not going to be anything left. Yeah. Forget about bleaching and the effect that us humans are having on the environment, causing the bleaching of the coral. When the bleaching takes effect because the water is warm in the Caribbean region, the bleaching gets worse. And if there's no coral for the marine life to sustain their self, the fishes go elsewhere too. and the marine life goes elsewhere. So this is a urgent plea. Please, I'm asking you, find a way of getting the DOE on here. And we need to let the government know they have to address this. They have to address it. I know this government has all of the ills that has been done for the last 40 or 50 decades to this country. They cannot fix everything one time, but we can sure make a dent on this to preserve that Caribbean Sea for future Caymanian generations, for future foreigners to come here and work on work permits to enjoy it, and for our visitors to continue to enjoy what most Caymanians do not understand. What we have here is paradise. That sea is paradise to those that cannot do it where they are. You have the Jamaican nationality that have lost access to their beaches. They come here and I watch them, they enjoy the beach. But then there are those that are stripping the coastline, and that's not right. We have to protect our coastline, and planning needs to do a better job of not allowing our coastline to continually be changed by building gazebos and patios and houses onto the Iron Shore. The Iron Shore, if most people do not understand what the Iron Shore was, or if you do not know what it was, and I'm going to leave it here after this. The Iron Shore was once the reef that was living, where these dive resorts here on Northwest Point have come and cemented walkways, patios, and built pools on the Iron Shore down here. There's 3 or 4 dive operations that own their own condo buildings and stuff down here that run their dive resort. And I say shame on them and shame on planning of this country, because we should never, Sandra, have allowed our coastline to change the way it is now, because that is a barrier, that is a protection for what? The hurricanes that we live in this area. We are in Hurricane Alley, and the Iron Shore was once the seabed. It happened, and it got raised up because when the tectonic plates of this world shifted, and the world was created the way it is on the continent. That's what happened. And eventually the Iron Shore became no more living coral. It died. But it was put there for a reason, to protect these islands, not for us to destroy it. So I'm urging the government, I'm urging you, please get the DOE on here, because we need the funds for DOE to be able to go out and hire the amount of marine officers that we need to patrol these 3 islands. Because as far as I was told by one of them, Cayman, as Grand Cayman, the size that it is, has 4 marine officers. That's too little. This is an urgent plea. We have to save this environment. And it is something that deserves attention, and it deserves the attention now. Because 10 years later on, we will not be able to fix what we as Caymanians have sat down and allowed to happen. And when you go to that shoreline and you don't see any fish, or you don't see any marine life, then the reality of what people are speaking has happened. And I would hate to be around to come back and say, I told Cayman so. So Caymanians need to protect the sea and what is on land. We cannot destroy things that are protected. I see them taking the moray eels. They catch them. They don't even release them back into the sea, Sandra. They just cut the hook off and throw it down on the Iron Shore. And it has this mentality of people coming here and going and buying 3 and 4 rod and reels as soon as they land, hey man, to come fish. That mentality and that has to go away. We have to put a stop to it. And by doing so, we're going to have to do it for a few years to stop the fishing on the Iron Shore. For the marine life to be able to replenish itself and for it to sustain the mighty Caribbean Sea, because this mighty Caribbean Sea is beautiful to look at, to swim in, and to enjoy. But when the mighty Caribbean Sea, Sandra, roars, she roars, and you do not go near her when she is rough. So
Okay.
Cayman, protect Cayman. It is up to us and every Caymanian. You have to protect this environment. So I'm begging you, get the DOE on your show so that we can tell them, because more than me seeing this happen, I know Mr. Taratarian calls in on it on Cape Radio Cayman Talk Show, and he talks about it here also. But this is an issue now. We have got immigration almost sorted. The environment is what this government needs to chase down the broken barrel that so many other successive governments of the past has left behind and refuses to tackle the issues. This is one of them. Our environment needs to be protected at all costs. Why? Because the trickle-down effect is tourism will disappear. The Caymanian fishermen's livelihood will disappear from here. And if you think it's easy to bring something back from extension, I'll leave you there.
Thank you, my dear. I appreciate it.
Yeah, this is the only one that I know has been brought back besides the bison that has been brought back. It was the Ridley sea turtle.
All right, leave me there.
It was brought back from extension almost 50 years ago. Thank you, Sandra.
Okay,
and
thanks.
Keep doing what you do. God bless you.
I appreciate it. Thank you so much.
Bye-bye.
All right, so some salient points there. Miss Anita says, I agree with the current caller, with the present caller. We have Mellow Fellow, good morning, says, good morning, CMR. Another option is to sell the turtle meat at the true cost of production to restaurants to help regulate the demand. The subsidized price should only be for households purchasing small amounts. Interesting. That's a good question. I mean, maybe that should be like the poll question of the day, Mellow Fellow, because yeah. I'm going to get some more information on the cost because somebody was telling me about it recently, but I can't remember the figures. So I'm going to do some digging and get you guys the figures as it relates to the cost of producing it and what they actually sell it at. Lady D says, well, it's time that they go back to allowing the fishermen to start turtling like many of our fathers and forefathers used to do. If they stop the sale of turtle, poaching will increase. I'm pretty sure that nobody wants to do that. Go back to turtling. No. I don't think that that's the solution. Okay, let's get another comment here. We have some coming in on WhatsApp as well. Let's see. Tourism in ministry is an avid fisherman. He needs to address this consumption by the Asian diaspora, especially. I'm going to send your comment, Anthony, to the minister. We would like to have him on the program. Anthony says cancer is not unique to Cayman. It's a global issue. Lady D says they be all over the island taking small fish. This is what happens when you allow expats that don't respect the laws already in place regarding fishing. Let me say this, just to play devil's advocate a little bit here. Could it be that they simply don't know even what the laws are? I mean, how would you know? If you're a Filipino and you come from the Philippines and you come off the plane, right, and you start fishing the following week, how would you know what the laws are, or even what the culture, because I don't know if it's a law, but what's the culture around fishing? I don't see, I mean, I hate to say this, but again, this made me think of my trip to the Galapagos, like in the airport while you're standing in that customs line on the, they had a big screen up there with all the do's and don'ts, right? And you're reading through the slideshow as you're standing there. You come to the Cayman Islands and there's no signage. There's no nothing. How do you know what's protected from what isn't protected? What are the standards? How does it work? There's no introduction to certainly work permits coming here, work permit holders, and what they should and shouldn't do. So let's not automatically assume that they're trying to offend us on purpose or they're trying to overfish on purpose. You know, that's what they do in their country. So maybe they think everywhere in the world that you go, that's just how you roll with it. I think we also need to admit that we should have more education around all of this. Island Pearl wants to know, where does the sister island get their turtle meat from? Are they allowed to get it from the ocean? Oh, that's a good question. I don't know. Turtle, Camry turtlers, Cayman Brackers, come on through. Because this is a curious question. And quite frankly, I don't even know the answer. I don't know. That's, you have me stumped there. I have no clue. It's a good question, Island Pearl. Anthony says high cancer rates are from the high carcinogenic foods we eat, like jerk. Yep, that's true. Obviously, he hasn't seen or smelled a commercial poultry, pig, or beef farm smell leave or turtle waste. You know, that's why I'm surprised that Marilyn isn't in the comment section, because she can say, yep, all y'all eating meat is nasty. That's why I'm a vegetarian. Lady D says, this is what happens when you increase your population to 100K. And hold on one second, sorry. They take to the sea to have food. Why? Because they don't have money to buy groceries, because the cost of food being unemployed. Because of the cost of food being unemployed. What? I don't get that last part. The cost of food being unemployed? Or are you trying to say that they're unemployed? Well, they shouldn't be in this country unemployed if they're here on a work permit. So Anthony says, them Filipinos know they have their seniors that do orientations. I'm not too sure about that. So many of them coming in now that, you know, Real Deal says it's not just the Filipinos that are eating small fish. I mean, exactly. A lot of times y'all looking at people and you think they're Filipinos, but they're not. They're from other Asian countries, but we're making assumptions about where they're from just by how they look. All right. Here's another question, or comment rather. They said a Caymanian lost his life. The callers glaze over that. Had they killed Mr. Christian, we wouldn't be talking about fishing. They equals non-Caymanian. Bringing home the point which I made earlier that makes this whole situation so incredibly sad. Because this was Caymanian violence on a Caymanian. Mr. Christian, old enough to be, you know, this guy's father. And look at what happened. Oh my God. So sad. All right. Let me just. Okay. So this person says, good morning. Isn't turtling now illegal from international standards? I think so too. I think so. All right. This person, lots of comments coming in. Give me 1 second. Hold on 1 second. Okay. Lots of very, very interesting comments. So I got an answer about that. Strong Wilk, you're so funny. Strong Wilk says to check with Carrie. You think she's the only Cayman Bracker? What? No, we want Cayman Brackers with sense. So I asked one of my Cayman Brackers with sense, and he replied and said that we get people that get from the turtle farm for us. So they're indirectly also getting it from the turtle farm, just that people bring it, I guess, on island. CE Bank said they know because I always ask them, they just don't care. Good morning, Sandra. What do you think about jerk turtle? Never thought about it, to be honest. So I have no clue what jerk turtle would taste like. That not came on saldo. So I don't know about the jerk turtle, honey. Chill. And like Anthony said, jerking food is really not the best way of cooking food for your health. in terms of the carcinage, because anything that is like, once you see that blackness on it from barbecuing, jerking, very similar types of cooking methods, y'all need to be scraping that off. That's why I tell them when I go get my pork, I don't like it charred. I be cutting that ish off of my meat because that's what gives you cancer right there. That bit is carcinogenic. El Rey says they have the money. It's being sent home. See, Ebank says Brackers get turtle meat from the farm, just like anyone on Grand Cayman. Yes, I know the other factors cause cancer, processed food, smoking, etc. One of the worst things you can do is processed meats, folks. All those, and some people eat processed meats every day. The things like, the deli meats, the, what do you call it? Bacon, all that kind of stuff. You got to try and get healthier options, but still really try to eat it in moderation. I know some of y'all don't want to hear that. Lady D says because of the cost of food and being unemployed, they shouldn't be here if they're unemployed, but we know. Okay. Anthony says that sounds like CC replying. Curtis Connect. Oh my gosh. You think Curtis only came in Bracker? Well, I know a lot of Brackers. Relax yourself. After yesterday's show, I gotta be honest with you, some people were like, boy, Sandy, I think something in the water with some of them Brackers, And I'm like, listen, I'm not really gonna go after my Brackers because they have one or two fool ones like Carrie. Because all the Cayman Brackers know who not got no sense. And they don't support the foolishness that they be going on with either. So I'm like, no, I not try to put everybody in one singular boat. That's like me saying all West Bayers, all this, all that. Just like all Filipinos not fishing either. Right? So Anthony says, Anna, hush about jerk turtle. And I soon want to curry it too. What else? Anna want change around here. Yeah, well, listen, if you're going to eat turtle, you got to do it Cayman style. Just leave it alone. So Island Pearl says, so wait, they have to pay to go over to pick up the person. It sends it down with someone. Just curious. I mean, I think it's like anything else that gets to the BRAC from Grand Cayman, right? Everything's imported in. So I'm assuming, people coming back and forth all the time. I'm sure people put in their little order because they have restaurants there that serve turtle. So they put in their little order too. I don't think it's all that serious. Cayman Maryland says, right, yeah, vexed because I can't find the cold hard truth on Facebook. Why? Girl, let me walk you through this again because it's really, really simple, actually. Hold on. It's so simple to find it on Facebook. What happens, though, is Facebook a lot of times doesn't put it on the page, like the home page, if you will, right? But let me show you, because I know I've showed y'all this before, but it's worth showing you again how this works. So hold on now, let me see. Is it this image over here? Okay, Jeff Bezos just showed up on my Facebook feed. Okay. Poor Jeff Bezos. He needs to stop with his foolishness. Okay, so when you're here, right, and you just go to the CMR page, you see the little picture. It actually says live, like literally right there. All you do is click on that, and that will immediately take you to the live feed. Boom, just like that. This is a live show right now. Because, let me tell you, you're looking for it here on the page. And like I said, Facebook is very panicky. Sometimes it shows up on the page here and sometimes it doesn't. So a lot of times what I end up having to do, if I remember, and I have to tell this to the content creators as well. Hold on. Is I have to manually put it there. So I have to do this and then copy this and manually put it there because it just doesn't put it like it should show up as a post like on here. And it just doesn't. The other thing you can do, but that's the easiest way. The easiest way to Facebook, just go to Facebook, click on I think this is the display photo, the profile photo. Just click on that. And once you're live, it automatically takes you to the live feed. The other thing I would recommend, but a lot of people enjoy watching it on YouTube. But the other thing I would recommend is follow our channel, which I know you're not on WhatsApp. So I'm probably realizing this isn't going to help you. But if you follow the WhatsApp channel, you get the links sent out daily as well. Anthony says, leave our brackers alone about water. It's something in the Cuban Cayman water. What Cuban Cayman water? Oh my God, what the hell? Say what? All right, I'm going to put the link on the homepage just in case, because I know most people, that's where you're looking for it. And sometimes Facebook puts it there and sometimes they don't, honey chill. Facebook is just a little bit weird at times. Duke Marin says Abbey Baden farm raised meats, including tortuga turtle, are full of urine, feces, antibiotics. They fight over space and bite up each other. Sore and pus. Oh my God. Talking about turning you off from turtle meat. Come on, stop it, Duke. Are common in their pool of water. They eat and drink all that crap. It gets into their biosystem. Cayman are amongst the highest obesity in the Caribbean. Low energy and focus, enriching mental challenges among our people. It's not how much you win, it's how long you last, says the Don from Icaria. Who's Don from Icaria? Okay, then. I guess he's telling you don't eat turtle meat. C.E. Bank says, watch the weather. Cayman is starting to build with thunderstorms down by Cayman. Lots of rain is coming. Yeah, we had some already. Oh, Bia and Javier. Child. KY Forever says, that's why I don't eat turtle meat. You'd be surprised at Caymanians that actually don't. All right, folks. So here's what I've done is I've reached out to someone at DOE. We're going to arrange a visit. So thanks to that caller for the recommendations. They do say that they are signs, but more are coming. There's currently no fishing license in force. So someone said, oh yes, let me go back to this comment. Hold on one second. Hold on one second. Oh, the computer's moving a little bit slow today. I always have connection interrupted. Wait for the complete answer. Okay, let's give that a second. Okay. Yes. So I'm following up in real time about some of this stuff. So I have sent the minister, I think it's Mr. Ruddy, about this turtle farm. Let me just confirm. I believe that falls under him. So I'll confirm and have some questions about that. And another person had the following to share. Let me just get my comments sorted out here. One second. Okay. And then we're going to start to wrap up the show because I got some court stuff to do today. All right. So this person says, I can't do this one up nicely. So I'm just going to quickly put this one on the screen. This person says it's mostly elderly Caymanians that purchase turtle meat, a few Jamaicans, but it's mostly Caymanians. The problem is Turtle Farm has a set limit on how much you can buy, and seniors carry on bad out there when they can't get what they want. Sandy, I've personally witnessed incidents where seniors be rude to the man involved and staff in his situation because they can't get the amount that they want. Some of them be demanding and disrespectful when they cannot buy over the limit you can purchase as an individual. Wow. No bueno. Please, folks, while we're talking about all these issues and population comes into mind again, do not forget that there are two surveys being conducted right now by the ESO. There is the annual business survey, and then there's also the labor force survey. Please participate in both of those if you get requested to do so.
The Economics and Statistics Office, ESO, is currently conducting the annual business surveys until June 12. The surveys collect information to answer questions like, how did the economy perform in 2025? In 2025, how much did foreign companies invest in the Cayman Islands? The surveys include all relevant entities that produce goods and services in the Cayman Islands. The surveys are confidential under the Statistics Act and are exempt from the Freedom of Information Act. Your response matters. Do your part. Fill out and return your survey forms to the ESO. Remember, better data, better decisions, better business. For assistance in filling out the forms or for more information, visit eso.ky or call 244-4676 or 244-4600.
All right, folks. Cayman, Maryland says, I used to click on live, but that option no longer is there. Only reels. Every once in a while, you show up in the feed. Sabrina is always in the feed. That's why it makes no sense. Yeah, that's Facebook for you. I don't know what to tell you. But from the computer, live is still there. But I'm assuming you're doing it from your phone. And I don't really know where live, I'd have to look on the phone to see where the live is. But let me just show you really quickly, actually. So if I go to on the computer screen again, if I go to more, there's live right there. And then there it is. So it could be that on the phone, it's a little bit more hidden than that. I wish we could customize, like, manage sections. So I wish we could move stuff up and down. Like, we can't even do that. Facebook is just Facebook. So let me just quickly see on the phone. So from the Facebook app, and I think it does make a difference. If I click on, so yeah, again, on the phone, the easiest thing is just to click on the little icon thing right there. But let me just show you. And then there it is. So it's still, when you go to the page, if you just click on the icon thing, but let me see. Yeah, you see, I don't see that more button on here. So I think on the app, it's not there. Yep. Which is weird. Mentions. So 2 days ago, someone sent, I don't know why this mention thing, again, I don't hardly ever see these. So this one says, hi, good morning, everybody. Just yesterday, I lost my car key near the South Church Street. It's best not to, oh God, I gotta go pick up my other glasses today. I had bent them up last week and they fixed them for me. It's best not to, I see messages on here that I've never seen before. So this was 2 days ago and then May the 11th about lost wallet. Just always WhatsApp, anything like that. Send a WhatsApp. I never see this section. Where do I find this section on the computer? This is where like people message us on the page. But I'm only now seeing all these messages here going back to February, January, even 2023. And we don't see these messages. They're not that easy to find. So I would suggest if you really have a message for us, you simply send us a direct message. Here's one from February. And this person saying that they've lost their passport. And I don't know what this one is about. This one says what? Okay, where did I find that just now? I'm trying to find it again. I went to the page. Oh, I went to mentions. Mentions. You see, I don't. Oh, there it is. Oh, it's kind of hidden. I'm going to be honest with you. So lost wallet at Valente. Oh, that was poor Miss Marlene. Oh, bless your heart. So she lost her wallet with $528 for rent money. Okay, anyway, that's Facebook for you. Good morning, beautiful people. Happy Tuesday. Once from going Facebook search and she'll always see the live and she can click on it. Yeah, I mean, you can definitely search for it as well. So you can put in the search option there. But I think if you just go to the page and then you just click on, sorry, I can't bring this up on my phone right now. I'm at the computer, but yeah, you just click on the same little live icon. It says 2026 logo. And that's still the easiest way to get to it. All right. Abby says, Duke Marin, enjoy your factory processed KFC while Cayman heritage goes to hell. I can tell you that Duke Marin is not an advocate of fast food because he's always here talking about stop eating ultra processed and fast food. So Duke Marin, probably a vegetarian. Are we eating chicken? I don't know. All right. Okay. All right. Very good. I got to go because, like I said, I got to do some legal stuff today that I really want to get done. Plus, I got homework due tomorrow, and I've got an appointment for my waxing lady, TMI, but she's going to do my armpits for me. Can I just tell you, I got something in my eye. My little Gigi keeps me on track with stuff, honey child. She's such a little lady already. She's only 9 years old, but child, she be, Mom, put your arms down. You got armpit hairs. And I'm just like, okay, I got to make an appointment to go get waxed. Well, don't show that. Don't wear that. Don't wear that top. Cover it up. I'm just like, Jesus. Okay. She'd be looking out for me, honey child. So, I tell her she got to wear more hair than me. She gonna be living up in the up in the wax ladies salon. Oh, my eyes are a little bit irritated. Got my eye drops, honey Jill. Sometimes your eyes be so dry and stuff, and you don't realize it till you actually put the eye drops in, and then your eyes are like burning. Do you guys ever have that? I have very dry eyes. I always did. Ugh. Okay. Tomorrow is Wednesday. We'll have more community discussions and news. We're actually putting up 2 interesting stories today. One is about Cayman Prep. They sent out another letter yesterday, so I'll get that one posted up here shortly. I'm actually doing the 2 stories myself. You know what? I've been doing more writing recently, which normally I'm not actually the one who's doing the writing on the website, but I've been doing more website writing because for school, I told you guys I'm doing a journalism course, right? Gonna get me a degree in journalism, honey child. But I'm able to submit those as my assignments as well. So it's kind of like a dual purpose. So I have some tutorial assignments. I have one assignment due tomorrow. They're forcing me to do like travel writing and stuff, which normally I don't do those things for CMR. So there's a whole section on writing feature stories and what's it called? Features and something. But anyway, the style of writing for CMR doesn't normally include feature writing. But I did write a piece on, because we can do like, interviews and, listen, I tell my instructor, I said, look, freelance and features. I said, look, this is 2026. We do video interviews where we just play the video and people enjoy watching it. But I must tell you that the course have forced me to explore feature writing a little bit more, because that's not the format really that we do here on CMR. And I wrote a piece based off of the interview that I did with Mr. Calvin Christian. I feel like it's one of my best pieces ever, because it's it brought out like my creative writing side. And, I don't know if I told you guys, I think you know this, I have a writing degree, right? So my first degree at USF is actually a writing degree. And in the back of my head, I've always been secretly a writer, which is so weird because I was never meant to be a writer. I was meant to be a lawyer. Like that's what you think in your head. And then life kind of throws you in and brings you back full circle. So interestingly enough, I have enjoyed the feature writing segment because it's brought out like more of my creative writing side. And I've always wanted to like write books and short stories and stuff. And so who knows, when I'm ready to retire in another 20 something years, I might have to return to one of my passions, one of my loves. And yeah. So anywho, I'll keep you guys posted. But I was thinking about the one that I wrote for Mr. Calvin. I might actually publish that on the website. So I might do a section for that sort of, like create a category for that sort of stuff and publish it, because I really enjoyed it. I enjoyed writing it. And I know that some people are still readers over watching video content. So I think some of you might actually enjoy it. So I'm gonna publish that one on the website. But yes, I've got an assignment due tomorrow. So I'm working on 2 stories. One is an interesting one. You guys are gonna find this very, very interesting. It's a little bit of law and news that nobody knows. But there's one about Miss Cayman. So I'm gonna publish that one today. And then I'm also gonna do the one on Cayman Prep. Cayman Prep is just, they refuse to acknowledge that this guy has lied to them, and that what we have proven to be a fact, that at some point his account was public. They refuse to, their investigation shows. No, you guys don't understand. There's no way. Cayman Prep, you are clueless about social media and technology. That's all that says to me. And you refuse to accept what is the only possibility of what could have happened. Now, that says a lot about a school. The fact that they're doubling down on his position, this was a private post, is to me shocking. And it says a lot about the school board and about the administrators at that school. I would not trust them with children if I were you guys, but there you go. Because they're doubling down in a position that is impossible. That from a tech perspective, as we realize, could not have been the case, and yet they are sticking firm to that. So we'll do a little updated story on that so that you guys keep abreast of how stupid, quite frankly, Cayman Prep is when it comes to technology in particular. All right, that's all she wrote, good folks. I'm out of here. You guys have a wonderful and super productive day, and we'll see you back here tomorrow morning. Okay, don't eat any turtle today. Turtle-free day. I know y'all like, girl, you must be crazy. Speaking of that, just a couple days ago, hold on. It was actually World Turtle Day. Hold on. Let me go back. World Hunger Day is coming up in a couple days on the 28th. But let me see now. World Turtle Day was, which day was it? Hold on. May the 23rd was World Turtle Day. So, and then World Ocean Day is coming up in June. So lots of World Environment Day is on the 5th of June. So lots of things around the environment, I think, that should make us pause and think a little bit more about what we're doing. All right, Abby, she says, kiss my teeth. Have a beautiful day, folks. I will see you guys next tomorrow. Yeah? All right. Take care until then.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.